I'm here to provide details to the South Australian public about the cases and about the risk that this poses to our state. And I know that you'll want to ask me some questions, but I would just like to have the opportunity to provide that detail first. But I would like to say that this is a very severe disease. We have had people very sick in our intensive care unit recently with COVID-19, and those have included very young people. So this is a serious problem. We've also had extensive modelling from the AHPPC about the Delta variant, and that if it gets into your community, it is very difficult to control, even with the sorts of lockdowns that we are seeing around the country. So we actually have 11 cases in South Australia today, but 6 of these are overseas acquired. 2 are old cases and previously counted, and they are all in the Medi Hotel. But let's focus on these 5 additional cases. We have the man who's in his 30s, who's the known close contact from the Northern Territory Tanami mine case. In addition, his wife is now positive. She's in her 30s, and there are 3 children under the age of 10. There's also a little bub who is not yet positive. What we're seeing with this Delta variant is that there's almost 100% hit rate in infections to those close contacts, except if people have been vaccinated. This family, as the Premier said, have been transferred to Tom's Court this morning. Now, I'll just want to give you the time frame and the reasons why we have some ongoing concerns and the reasons why we have put some further restrictions in place today, and why our team has been increased in size today, and we have certainly a lot of work to do, and we've been working overnight to help contain this issue. So the miner travelled on a charter flight into Alice Springs on the 25th, which is Friday the 25th. He was in Alice Springs for about 6 hours in the Alice Springs airport, and our information is that he wore a mask. But obviously when you're there for 6 hours, you're going to have to take your mask off for eating and drinking. He then boarded a Virgin flight, and that was on Friday the 25th, and it's VA 1742, and it arrived into Adelaide at 5 p.m. on Friday night. Now, this gentleman did what you do when you're on air flights now in Australia and wore his mask. He only had hand luggage, and so he came out of the flight through the airport and quickly moved through the airport, and his wife picked him up. As I understand it, they swapped over the driving, and he proceeded to drive home. Now, on the way, he did stop to get some takeaway food, and then he went home. We have been involved in South Australia at helping to coordinate, along with the Commonwealth, the follow-up of over 900 miners, so a very big exercise. But the mine themselves, and I was very lucky to actually visit Olympic Dam last week, the mine themselves, and this is obviously not Olympic Dam, but this is Tanami mine, have a very good way of doing their contact tracing, and they had already texted all of the miners that had left the site that were at risk. And so this gentleman received this information, and that was why he got a test that morning. And we had a result back at 11 o'clock that it was indeed negative. He proceeded to go home, and he has quarantined, as I said, with his family during that time. Now, there are some little complications here. So one of the things was he has some mild symptoms on Saturday, but many of us have mild symptoms at the moment, right, of colds, but he tested negative. He then developed a headache and some aching muscles on Monday, and because of that, he went and got retested on Tuesday, and unfortunately his wife also developed headaches and got tested on Tuesday, which was yesterday, and both of those tests have come back positive. We've subsequently had our domiciliary testing go to their house and get tests late last night. This poor family, it's pretty disruptive. But unfortunately, we have got those results back that 2 of the young ones are positive. One's presumptive, so in the start of the infection, and the little bub, fortunately, at the moment is negative. And as the Premier said, they have been transferred to Tom's Court. Now, in our experience working across the last 12 to 18 months with COVID, we have occasionally had a false negative result. And the reason for that is not because of our laboratory, but sometimes if you've gone and had a COVID test, sometimes you'll find it's quite painful, but occasionally you'll get one that's just not as painful and you'll think, gee, that was pretty easy. And occasionally the collection is not deep enough. Now, because I am going to take an absolute abundance of caution, because I do not want this this Delta wave in our community for obvious reasons. We are going to be considering that could possibly have been a false negative test on Saturday. And because of that, we have determined that everybody that was on that flight will be going into quarantine. And we've SMS'd using the manifest this morning, and we've been able to contact 108 people, and we're asking them to get tested, and we're asking them to quarantine. Now, there's a small number. When you get manifest, not all the mobile phones are correct, and there's a small number of people that we haven't been able to pick up yet. And so I'm asking you, if you have been on that flight, and I'm very grateful to journalists here to make sure you get this message out. If you have been on that flight on that Friday, it's very important that you get tested and you go in quarantine until you hear from SA Health. The other potential exposure site, even though he was wearing a mask, is the airport. So again, we have good contacts at the airport, we have CCTV footage, and what we will be doing is looking at that potential pathway today to see if there's anybody else that we need to have tested and indeed quarantined. Our team have already contacted the takeaway food area and shop, and so again, we're doing the contact tracing in an abundance of caution in the face of possibly a false negative test. And then the other, a couple of people that we have already had tests back this morning, I'm really pleased to be able to report this, is these kids' grandparents who had very, very brief contact with this family on Saturday. And those tests have come back negative this morning. I'm very, very pleased that we've got that result. There was a couple of other areas, and again, you can understand that we are thinking logically through any of these pressure points or potential exposure points. Those are when this family went and got tested. So that is a couple of our SA pathology staff and also one of our private pathology providers. And we also will require those people to be tested and have a quarantine period. And so, as you can see, even though these people absolutely did the right thing, they quarantined, my understanding is they had food dropped off and the like, we're just spreading the net a little bit more broadly because we do not want this Delta strain in South Australia. So in terms of our restrictions here, obviously because this is at the moment contained and we're trying our very best over the next 24 hours to make sure it stays that way, we do not require a lockdown here in South Australia, but what we do need is people just to be really sensible at this point in time. We've also got as a potential risk the other minors, and my team will be chasing them up and making sure that we retest. Of course, when you're in quarantine, you do require tests at certain times. We just want to make sure we've touched bases with all of those people. This will be the reason why as well that there's potentially contact tracing happening in the Northern Territory around the time that Minor was at the Alice Springs airport. So lots of work to do. And I'll pass over to the Police Commissioner, we have recommended that we change a little bit of our direction. We want to only have 10 people in the home. The private gatherings will stay at 150. Masks are a really simple way of protecting all of us from us, protecting yourself and protecting other people. So we will be having a strong recommendation for wearing masks in indoor public spaces, and that's the sort of place where you're coming in contact with a whole lot of people you don't know and you can't stay away from each other. Also, the Delta variant is very transmissible and you can just have this very fleeting contact. I'm not wearing a mask in here today. I happen to know everybody else who is in the room today, and if we needed to, we could do that contact tracing.